I'm about to tell you something that could save your life. Something I see in the operating room that your primary care doctor will never catch. Heart failure doesn't begin with chest pain. It doesn't warn you with a sudden collapse. It starts quietly, slowly, almost invisibly. And the signs I'm about to share aren't the ones you've read online. These are things surgeons notice. Subtle patterns I've learned after more than 20 years of opening chests and holding failing hearts in my hands. I'm Dr. Emily Mack. I'm a cardiac surgeon, and what I'm about to explain isn't taught in medical school. Most primary care doctors miss these warning signs because they're trained to look for obvious symptoms. Swollen ankles, trouble breathing when walking, the classic textbook signs. But heart failure is smarter than that. It hides. It pretends to be other problems. And by the time the obvious symptoms show up, the damage is often permanent. The signs I'm sharing today are different. They're specific. They're the patterns that make me pause during an appointment and say, "We need an echocardiogram." By the end of this video, you'll know exactly what to watch for. You'll understand what's happening inside your body, and you'll learn about the one blood test that can catch heart failure before it takes over your life. Let's begin with sign number 5. You've stopped sleeping in your bed. Over the last 6 months, you've slowly added pillows. First one more, then another, then another. Now you can't lie flat at all. You've moved to sleeping in a recliner. You tell yourself it's just more comfortable. You think your back feels better that way. But it's not your back. It's your heart. This condition is called orthopnea. It's one of the most specific signs of left-sided heart failure we know. Here's what's happening. During the day, when you're upright, gravity helps you. It pulls fluid down into your legs and away from your lungs. Even if your heart is weak, it can manage this. But the moment you lie flat, gravity stops helping. The fluid that's been sitting in your legs all day moves back toward your chest. Within minutes, the amount of blood in your chest increases by 20 to 30%. Now your weakened left ventricle is overwhelmed. It can't pump that extra blood forward. The blood backs up into your lungs. Pressure rises in the lung vessels, like water backing up in a blocked pipe. Once that pressure gets high enough, fluid leaks into the air spaces of your lungs. This is pulmonary edema. Your lungs are filling with fluid. You're slowly drowning from the inside. Your body senses this before you fully realize it. Your brain notices rising carbon dioxide levels. You feel uneasy, restless, uncomfortable. You sit up without thinking about why. And the moment you're upright, gravity pulls that fluid back down. The pressure drops. You can breathe again. This happens so slowly that most people never see it as a medical problem. They think it's aging. They blame the mattress. They convince themselves that sleeping with 3 pillows is just personal preference. It's not preference. It's your body compensating for a failing heart. Robert was 74 years old and hadn't slept in a bed for 8 months. He thought he had a bad back. I knew his heart was failing. His echocardiogram showed an ejection fraction of 30%. His heart was only pumping a third of the blood it should with each beat. Every night, when he tried to lie flat, fluid built up in his lungs within 10 minutes. The key detail here is how gradual this is. Orthopnea doesn't appear suddenly. You add 1 pillow, weeks later, another. Each change feels small, so you don't connect them. But when you look at the pattern, it's clear. If you can't lie flat anymore, if you need 3 or more pillows, if you've moved to a recliner, your heart is failing. This is not the same as sleep apnea. Sleep apnea causes snoring and pauses in breathing. Orthopnea causes breathlessness from fluid in the lungs. The treatments are completely different. One uses a mask. The other requires diuretics and proper heart failure care. Here's what you need to understand. Your heart is a pump. When that pump weakens, it can't handle changes in blood volume. Lying flat increases preload, which means more blood returns to your heart. A healthy heart handles this easily. A failing heart cannot. Fluid buildup follows a clear pattern. First, it happens in your lungs at night. Then it starts during the day. Then your legs swell. Then fluid builds up in your abdomen. Without treatment, this progression doesn't stop. If you're sleeping upright, if you've added multiple pillows, if you can't remember the last time you slept flat, you need to be evaluated. This is not normal aging. This is your heart telling you it can't keep blood moving forward. You can walk across the room without trouble. You can climb stairs. You don't feel short of breath during daily activities. But the moment you bend forward to tie your shoes, within 30 seconds, you're gasping for air. You have to sit up, catch your breath, then try again. Your doctor thinks you're just out of shape. You think maybe you held your breath. Both of you are wrong. This is bendopnea, a sign of high pressure inside the heart that many doctors have never even heard of. Here's what's happening. When you bend forward, several things occur at once. Your diaphragm moves upward into your chest, increasing pressure inside your chest cavity, like squeezing a balloon. At the same time, bending compresses your abdomen. This pushes blood out of the abdominal veins and sends it quickly back to your heart. Blood return suddenly increases. In a healthy heart, this isn't a problem. The heart stretches and pumps the extra blood forward. But in a failing heart, especially one that's stiff and can't relax properly, this sudden load is too much. The left ventricle can't handle it. Pressure instantly backs up into the lungs. Lung vessel pressure spikes. Just like water hitting a blocked drain, fluid is forced out into the lung tissue. Within seconds, you're short of breath. Think of your heart like a container with limited space. When you're upright, it's already close to full. When you bend forward, you suddenly pour more fluid into it. It overflows. That overflow is fluid in your lungs. Margaret was 69 and couldn't bend down anymore. She thought it was her weight. I asked how fast the breathlessness started. She said within 20 seconds. That's not being out of shape. That's elevated cardiac filling pressures. Echocardiogram showed severe diastolic dysfunction. Her ejection fraction was normal at 60%. This is called heart failure with preserved ejection fraction. Her heart muscle was squeezing well, but it was so stiff that it couldn't relax and fill properly. Every time more blood returned to the heart, it had nowhere to go. The pressure backed up immediately into her lungs. This is something surgeons notice, but primary care doctors often miss. They hear shortness of breath and assume it's chronic or related to fitness or age. They don't ask the critical question, does it happen specifically when you bend forward? That detail matters more than anything. Bendopnea is so closely linked to high filling pressures in the heart that it's been confirmed in multiple studies. In one study, patients with bendopnea had an average pulmonary capillary wedge pressure of 25 millimeters of mercury, which is dangerously high. There's a simple test you can do at home. Sit in a chair. Bend forward at the waist like you're tying your shoes. Stay there for 30 seconds. If you become short of breath during that time and the breathlessness goes away when you sit back up, that's bendopnea. You need a heart evaluation. This is not anxiety. Anxiety doesn't follow clear physical rules. This is physics. Increased pressure inside the chest, plus a sudden rush of blood back to the heart, causes a rapid rise in pressure in the left atrium. A weak or stiff heart can't adapt. The reason this matters is because bendopnea predicts worse outcomes. People with bendopnea are hospitalized more often and have higher death rates from heart failure. It's a sign of advanced disease, even when everything else seems mild. If you can walk without trouble but can't bend forward without gasping, your heart is failing. Don't let anyone brush it off. Ask for an echocardiogram. You wake up 3 times every night to urinate. You assume it's your prostate. You see a urologist. They prescribe medication. Nothing changes. You're still getting up 3, 4, even 5 times a night. No one looks at your heart. This is nocturia. And in many cases, it has nothing to do with your bladder. It's your heart-clearing fluid that built up in your body during the day. Here's what's happening. During the day, you're upright. Your heart is weak. Blood flow from the heart is reduced. Less blood reaches your kidneys. Your kidneys sense this drop and react by holding on to sodium and water. Your urine output during the day is low, but the fluid still accumulates. Gravity pulls it into your legs. By evening, your ankles are swollen. Your legs feel tight and heavy. You've gained 3 pounds of fluid since morning. Then you lie down to sleep. Gravity no longer pulls fluid into your legs. That fluid moves back into your circulation. Suddenly, your blood volume rises. Your kidneys detect this and think conditions are finally safe to release fluid. They start making urine, a lot of it. All the fluid that was trapped in your legs during the day is now being filtered out at night. You wake up every couple of hours needing to urinate. This is your heart's daily cycle of failure and compensation. During the day, your weak heart can't supply your kidneys well enough. At night, lying flat improves blood flow just enough for the kidneys to catch up. Think of it like a reservoir. During the day, water trickles in because the pump is weak. The reservoir overflows and spills into the surrounding ground, your legs. At night, a valve opens and all that extra water drains at once. James was 71 and waking up 5 times a night. His urologist ran every test, all normal. I asked one question. Do your legs swell during the day? He said yes. His socks left deep marks. That was the missing link. Leg swelling during the day plus nighttime urination equals heart failure. His echocardiogram showed biventricular dysfunction. Both sides of his heart were failing. Right-sided failure caused the leg swelling. Left-sided failure reduced kidney blood flow during the day. At night, lying flat improved heart output just enough for the kidneys to work. Here's the pattern to watch for. If you urinate more at night than during the day, if the amount at night is large, and if this improves leg swelling by morning, this is cardiac nocturia. This is not an overactive bladder. An overactive bladder causes small, frequent trips day and night. Cardiac nocturia causes large amounts of urine mostly at night, with reduced output during the day. This is basic kidney physiology. Your kidneys need enough pressure to filter blood. When your heart can't generate that pressure during the day, your kidneys slow down. At night, when circulation improves, they work overtime. Cardiologists rely on this pattern. If you tell me you're waking up 3 or more times a night to urinate and your legs swell during the day, I order an echocardiogram before sending you to a urologist. This matters because nocturia caused by heart failure won't improve with prostate or bladder medications. You're treating the wrong organ. The bladder isn't the issue. The prostate isn't the issue. The heart is. If you're waking multiple times at night to urinate, especially passing large amounts, and especially if you have leg swelling during the day, demand a heart evaluation. Get a BNP blood test. Check your ejection fraction. Rule out heart failure before wasting months on treatments that won't help. You have no appetite. You feel full after just a few bites. You eat less than half of what you used to, yet the scale keeps going up. You gain 5 pounds in 2 weeks despite barely eating. This shouldn't be possible. Fat comes from calories, and you're not eating them. So where is the weight coming from? It's not fat, it's fluid. Poor appetite combined with weight gain is one of the most specific signs of advanced heart failure. Here's why. When the right side of your heart fails, blood backs up into your liver and intestines. This causes liver congestion and swelling in the gut. Your liver enlarges and stretches its capsule, causing a dull ache under the right ribs. Your intestines swell with fluid. This does 2 things. First, the stretched gut sends signals to your brain that you're full, even when you're not. This is early satiety. Second, the swollen gut can't absorb nutrients properly. Food sits there, causing bloating and nausea. You lose your appetite completely. So you stop eating. Your calorie intake drops to 800, 600, even 400 calories a day. By every rule of biology, you should be losing weight fast. But instead, you gain weight. This is because your failing heart activates the renin-angiotensin-aldosterone system. This system exists to protect you. When heart output drops, less blood reaches the kidneys. The kidneys think you're bleeding or dehydrated. They respond by constricting blood vessels to raise pressure, releasing aldosterone to retain sodium, and holding on to water. Sodium pulls water with it. Your body traps every drop of fluid it can. This helped our ancestors survive dehydration. In heart failure, it makes everything worse. You add liters of fluid to a system that's already overwhelmed. The result is rapid weight gain from water, not food. You're starving and drowning at the same time. Muscle breaks down from lack of nutrition, while fluid fills your tissues. The scale rises as your body weakens. This is cardiac cachexia, a late and dangerous sign. When this appears, heart failure is advanced. David was 73. He lost interest in food over 3 months. He couldn't finish meals but gained 12 pounds. His exam told the story. His abdomen was swollen, and a fluid wave was present. That means fluid shifted like water in a balloon. He had 3 liters of fluid in his abdomen. His legs were severely swollen with another 2 liters. His neck veins were bulging, showing blood backing up. His echocardiogram showed severe biventricular failure with major tricuspid valve leakage. His right ventricle was so weak that blood flowed backward with every beat. Poor forward flow caused congestion. Congestion made the valve leakage worse. That pushed the heart into a faster downward spiral. Here's what most doctors miss. They see weight gain and assume the patient is overeating. They advise diet changes and more exercise. They completely overlook the fact that the patient has no appetite and struggles to eat at all. They don't ask about feeling full too quickly or constant nausea. But when you ask the right questions, the pattern becomes clear. How much can you eat in one sitting? Just a few bites. Do you feel full almost immediately? Yes. Is your belly swollen or tight? Yes. Are you gaining weight anyway? Yes. That combination points directly to heart-related congestion. The physiology behind this is critical. Your liver needs steady blood flow to function. When blood backs up into the liver cells can't do their job properly. They can't make proteins. They can't process toxins. One result is low albumin levels in the blood. Albumin helps keep fluid inside your blood vessels. Think of it like a sponge or magnet that holds fluid where it belongs. When albumin drops, that holding force weakens. Fluid leaks out more easily. Swelling gets worse. Your intestines also need blood flow to absorb nutrients. When the veins supplying the gut are congested, the intestinal wall swells with fluid. Absorption fails. Even the small amount of food you manage to eat isn't being absorbed well. You become malnourished even though you are eating something. This is why cardiac cachexia has such a poor outlook. You lose muscle from starvation, and your heart muscle is part of that loss. A starving heart becomes weaker. The cycle feeds itself and can become irreversible. If you're losing your appetite while gaining weight, if you feel full after only a few bites, if your abdomen feels bloated or tight, you need urgent evaluation. This is not a diet issue. This is advanced heart failure. Go to a hospital, get a BNP test, get an echocardiogram. This combination predicts a high risk of death without treatment. You eat lunch. Within 30 minutes, you feel dizzy and lightheaded. Your thinking gets cloudy. You can't focus. You assume your blood sugar dropped. You check it. It's normal. You think maybe you ate too much. It's not your blood sugar. It's not overeating. It's your heart. What you're experiencing is called postprandial hypoperfusion. Blood is being sent to your digestive system, and your weak heart can't supply both your gut and your brain at the same time. Your brain loses oxygen. Here's how this works. When you eat, especially a large meal, your body sends a large amount of blood to your digestive organs. Digestion takes a lot of energy. Your gut needs oxygen to break down food, absorb nutrients, and move everything along. In a healthy person, this isn't a problem. The heart simply pumps more blood. Cardiac output rises by 20 to 30% after a meal. Blood flow to the gut increases while blood flow to the brain stays steady. But in heart failure, the heart is already working at its limit just to keep things stable. It can't pump more. It has to choose where the blood goes. It prioritizes the gut because digestion demands it. The brain gets less. The brain is extremely sensitive to oxygen loss. It can't store oxygen. Even a small drop in blood flow causes symptoms: dizziness, lightheadedness, confusion, trouble thinking, vision changes. This is postprandial hypoperfusion syndrome, a sign of severely reduced heart reserve. Think of your heart like a limited power source. You have 100 units of power. At rest, your brain uses 40. Your gut uses 20. The rest of your body uses 40. Everything balances. After a meal, your gut suddenly needs 60 units, but you still only have 100 total. Something has to give. The brain drops to 20. The lights dim. Eleanor was 80 years old. Within 20 minutes of eating lunch, she became confused. She forgot conversations. She became disoriented. Her family thought it was dementia, but I noticed the pattern. It only happened after meals. Between meals, her thinking was clear. Dementia doesn't work that way. Alzheimer's doesn't follow meal timing. Her echocardiogram showed an ejection fraction of 28%. Her heart was so weak that digestion deprived her brain of oxygen. Within 30 minutes of eating, blood flow to her brain dropped by 25%. Her neurons couldn't function. She looked demented, but she wasn't. We started heart failure treatment with ACE inhibitors, beta blockers, and diuretics. Within 2 weeks, the confusion after meals disappeared. She could eat without mental fog. She didn't have dementia. She had poor blood flow. Here's what primary care doctors often miss. They see confusion in an older patient and assume a brain problem. They order brain scans. They label it dementia. They don't ask the one question that matters. Does this happen after meals? That question changes everything. If confusion appears after eating, it points to the heart, not the brain. The mechanism is simple blood flow physics. Blood flow to the digestive organs increases by 30 to 40% after a meal. In heart failure patients whose heart output can't increase, that extra blood has to come from somewhere. It comes from the brain and the rest of the body. Studies measuring brain blood flow show clear drops after meals in heart failure patients. The bigger the meal, the bigger the drop. This is why many people with heart failure stop eating large meals. They don't know why, but they learn that eating makes them feel awful. They switch to very small meals spread throughout the day. This helps because smaller meals need less blood flow. The brain doesn't get deprived as severely. If you feel dizzy, confused, or lightheaded, specifically after eating, especially after bigger meals, this is a warning sign of advanced heart failure. Your heart has no reserve left. It can't support digestion and brain blood flow at the same time. This is not the same as low blood sugar after eating. Check your glucose during symptoms. If it's normal, it's not sugar. It's blood flow. It's also not the same as blood pressure dropping when you stand up. Post-meal symptoms happen while sitting still. You don't have to change position. Eating alone triggers it. If this is happening, you need urgent evaluation. These symptoms mean your heart is operating on the edge. Any extra stress could push you into sudden heart failure. We've now covered 5 signs that primary care doctors often miss: sleeping in the recliner, gasping when tying shoes, frequent nighttime urination, losing appetite while gaining weight, and mental fog after meals. These aren't the classic signs of heart failure. They're the subtle ones. The patterns you learn only after years of surgical experience. The clues that tell me a heart is failing long before the obvious symptoms show up. If you have any of these, you need one specific blood test: BNP, B-type natriuretic peptide. When your heart is stretched from pressure or excess fluid, it releases BNP into your blood. This hormone tries to help by relaxing blood vessels and pushing sodium out through the kidneys. It's your body's attempt to reduce the strain on your heart. BNP levels rise as heart failure gets worse. Normal is under 100 picograms per milliliter. If it's elevated, your heart is under stress. BNP is very sensitive. It detects heart failure early. Even more important, if your BNP is normal, heart failure is unlikely. A normal BNP almost rules it out. This test costs less than $50. It's one blood draw. Results come back quickly. It can save your life. Go to your doctor and say this: "I'd like my BNP checked. I'm having symptoms that concern me for heart failure, and I need to rule it out." Most doctors will order it right away. If your BNP is high, demand an echocardiogram. The echo will show how well your heart pumps, how your valves are working, how stiff your heart muscle is, and whether your chambers are enlarged. It will give clear answers about what's wrong. From there, treatment is straightforward. Diuretics to help remove excess fluid. ACE inhibitors or ARBs to lower afterload, which is the resistance your heart has to pump against. Beta blockers to help the heart work more efficiently and to slow harmful structural changes. Sometimes aldosterone antagonists are added if the disease is more advanced, but the most important factor is early detection. When heart failure is found early, it is very manageable. People can live for decades with a good quality of life. When heart failure is found late, the outlook is grim. The 5-year death rate is worse than many cancers. These 5 signs are your early warning system. You have to pay attention to them. Before I close, I want to share something I'm building. It's called Senior Health Life Daily. It's a community where I share medical information in much more detail than I can in short videos. I'm currently finishing an ebook focused entirely on heart and blood vessel health for seniors. It covers everything: how to understand your lab results, what questions you should ask your cardiologist, which symptoms mean an emergency and which ones can wait, medication side effects doctors often don't talk about, diet and lifestyle changes that actually make a difference. This ebook will be available only to members of Senior Health Life Daily. To join, click the link in the description and enter your email. You'll be the first to know when it's released. I don't sell products, I don't run ads. This is simply a way for me to share deeper information with people who want to take control of their heart health. Join the community. Be part of something that could truly save your life or the life of someone you care about. Today, I shared 5 signs of heart failure that primary care doctors often don't know to look for. The recliner chair sign from orthopnea, the shoelace sign from bendopnea, the bathroom run sign from nocturia, the appetite paradox from cardiac cachexia, the after-lunch fog from postprandial hypoperfusion. These are surgeon secrets, patterns I've learned from years of holding failing hearts in my hands and watching what happens to the rest of the body when the pump starts to fail. If you're experiencing any of these symptoms, speak up for yourself. Ask for a BNP blood test. Get an echocardiogram. Don't accept "it's just aging" as an answer. Early detection saves lives, but only if you know what to watch for. Share this video with anyone over 60. These signs could save someone's life. Leave a comment if any of these symptoms sound familiar to you. Your story might help someone else recognize their own warning signs. Subscribe if you haven't already. I'm committed to sharing medical knowledge that can keep you out of my operating room. Take care of your heart.